So I'm going to be talking about why we do ear tubes in kids. Two of the biggest reasons why we place ear tubes in kids is because of hearing loss due to either fluid buildup in the middle ear space, or it's due to recurrent ear infections. I'll talk about the first one. Whenever we have fluid buildup into the ear, this fluid can give you that waterlogged sensation or give you that sensation that your ears are just full of fluid. And the fluid mechanically blocks the sound waves from getting into the ear. The reason why this is important in children is because the children they have a critical period of language acquisition where they learn speech and language. And if they're not able to hear speech and language, they're not going to be able to develop it. And there could be signs of speech delay where they're not learning as many words or they're behind in school. And so this is something that if you're a pediatrician or you are noticing, it is important to get a hearing test, which we can help you with in our clinic and get you seen immediately so that we can talk to you about whether or not ear tubes is something that we should consider for your child. The other reason recurrent ear infections is an important one because it can have a huge burden on our healthcare system and on you. As a parent, it's tough as it is to bring your child to the pediatrician, but have to go back and forth because your child has had multiple ear infections. It could be due to the fact that their eustachian tubes are not quite yet mature. Ear tubes is a way to bypass your natural body's eustachian tube, at least until the child is old enough so that their eustachian tube is mature and working on their own. This can sometimes take up to about 6 to 8 years of life. And so for that period of time before, ear tubes can be a lifesaver. Now, we don't typically want to put ear tubes on everybody, so we typically try to be selective. And so if your child has had frequent ear infections, it's worth talking to your pediatrician for a referral to come see us so we can talk to you about ear tubes.